Okay, so Assalamu alaikum. Well, in this video, we'll take a look at the deep pectoral fascia and clavipectoral fascia. Now, these are two fascia present in the pectoral region. मगर ये थोड़े different होते हैं, but we often get confused in these. So I'm going to teach these two together so that we don't get confused. कि दोनों एक नहीं होते. So the first one is a deep pectoral fascia. Definitely, the fascia present deep to the superficial fascia will be called as a deep pectoral fascia. But in this case, specifically, it is the fascia covering the pectoralis major muscle. So the fascia that covers the whole that bulky muscle up, that is called as the deep pectoral fascia. So this is the deep pectoral fascia, as you can see, covering the whole of the pec major muscle. Now we'll be talking about the attachments of each of this muscle के इसकी attachments कहाँ कहाँ हैं, superiorly, laterally, medially, inferiorly, etc. So superiorly this muscle will be attached to the clavicular portion, right, the clavicle, right. So the superior attachment of deep pectoral fascia is actually the clavicle, because we know that even the pec major muscle gets originated from the clavicle, right. So anteriorly it will be attached to the sternum bone, right. Supralaterally this muscle extends over the infraclavicular fossa and the deltopectoral groove. Now you have no idea about what is the infraclavicular fossa or what is the deltopectoral groove, but don't worry, let us take a look at it. So as the name suggests, the fossa, the depression present beneath or below the clavicle, that is called as the infraclavicular fossa. So this is actually infraclavicular fossa, and this is the point जिसके ऊपर से गुजरकर हमारा deep pectoral fascia laterally move करता है, right. And the next important term was the deltopectoral groove. As the name suggests, this is a groove or depression present between the deltoid muscle laterally and the pec major muscle medially, right. So एक हल्का सा groove सा होता है, so इसके ऊपर से गुजरकर हमारा ये deep pectoral fascia laterally move करके हमारे the fascia covering the deltoid muscle के साथ जाकर attachment ले लेता है. So in this way, this whole was the supralateral attachment of the deep pectoral fascia, that it crosses the infraclavicular fossa, then it crosses the deltopectoral groove, and eventually it gets attached to the fascia covering the deltoid muscle. तो ये होगी उसकी supralateral attachment. Now take a look at its infralateral attachment. So infralaterally this fascia it curves around and it gets continued with the axillary fascia, that is the fascia of the axilla or the fascia covering the axillary vessels and nerves, etc., right. So here, right here in the axilla region, this fascia infralaterally moves and gets attached or gets continuous with the axillary fascia, right. So inferiorly this deep pectoral fascia will be passing over the thorax and the rectus sheath. Now what is rectus sheath? It's a fascia, it's a deep fascia, it's a sheath, which you can say covers the rectus abdominis muscle, and you have no idea about this muscle because it will be taught in second year, right. So these all were the attachments, clavicle, sternum, deltoid के ऊपर वाले fascia पर, axillary fascia पर और thorax में और rectus sheath के साथ, these whole are the attachments of the deep pectoral fascia, right. And it must not be confused with clavipectoral fascia, क्योंकि उसके attachment हम अभी देखेंगे कि वो उसकी attachments काफ़ी minor होती हैं, इसकी काफ़ी major और काफ़ी bulky attachments और काफ़ी बड़े structure को ही cover up कर रहा है, while the clavipectoral fascia is only a small fascia which is lying deep to the clavicular head of pec major muscle, like this. So only this is the site of location of the clavipectoral fascia. It is a fascia lying deep to the clavicular head of the pec major muscle, because we saw that the clavicle was the pec major was having a number of attachments, right. It was also coming from the clavicle, it was coming from sternum, it was coming from external oblique aponeurosis, right. So right where the pec major is getting attached to the clavicle, just beneath that, just you can say deep to that level, we have the presence of a very good fascia that is called as the clavipectoral fascia. And now we'll take a look at the attachments of this clavipectoral fascia, just like we talked about the attachments of the deep pectoral fascia, right. So it's a fibrous sheath which is lying deep to the clavicular portion of the pec major muscle. It extends from the clavicle all the way to the axillary fascia, right. So ये तो हो गया उसका extent. कहते हैं कि upper part में this fascia, this sheath, it split करती है और ये enclose कर लेती है अपने अंदर किसको, subclavius muscle को, which was a muscle attached to the subclavian groove on the inferior aspect of clavicle bone, right. So as we say that this is located just you can say deep to the clavicular head of pec major muscle, तो वहीं पर ही हम पता है कि लोकेशन होती है सबक्लेविस की भी, तो वहीं पर ना ये खुद को यू कैन से स्प्लिट करती है और इंक्लोज कर लेती है सबक्लेविस को सुपीरियरली, ठीक है. और इन्फीरियरली यही फेशिया, यही क्लाविपेक्टोरल फेशिया स्प्लिट करके अपना अंदर इंक्लोज करता है किसको, पेक माइनर मसल को, राइट. Now we know that the deep pectoral fascia was enclosing in itself the pec major muscle, but the clavipectoral fascia is enclosing in itself what, the pec minor muscle along with the subclavius muscle, right. So these were the we can say the structures which were enclosed in the clavipectoral fascia. And we were talking about the attachments. So basically जब ये सबक्लेवियस मसल को अपने अंदर इंक्लोज करते हैं तो उसके दो लेमिना बन जाते हैं, लेमिना एंटीरियर टू सबक्लेवियस होगा और एक लेमिना पोस्टीरियर टू सबक्लेवियस होगा. सो जो इसका लेमिना या जो इसका शीट होती है बिहाइंड द क्लेविकल, सॉरी बिहाइंड द सबक्लेवियस, दैट गेट्स अटैच्ड टू द डीप सर्वाइकल fascia. Now what is deep cervical fascia? It's fascia present in the neck region. Cool. So when you will be studying the head and neck anatomy, we'll be talking about this deep cervical fascia, which is the deep fascia of the neck region. So behind the subclavius muscle, this clavipectoral fascia gets continued with the deep cervical fascia. Okay, and also to the axillary sheath जो कि इस region में होती है. So inferiorly this clavipectoral fascia will be splitting up to enclose the pec minor muscle, and medially it is attached to the external intercostal muscle, which are the muscles of the what? Thoracic region, right? So laterally this will be getting its attachment on the coracoid process of scapula, just like the deep pectoral fascia. तो इन दोनों के attachments so and so एक जैसे ही हैं. So we must not get confused in these two. clavicle पर वो भी attach होता है, ये भी हो रहा है. coracoid process पर वो भी attach होता है, ये भी हो रहा है. ये भी थोड़ा बहुत sternum पर attach हो रहा है, लेकिन बहुत ज़्यादा नहीं. उसका काफ़ी ज़्यादा diverse attachments see. And just like that, it is also getting attached to the axillary sheath. But that was enclosing the pec major muscle, but this is enclosing only the pec minor and the subclavius muscle. Cool. So then we say that there are some of the structures which pierce this or which pass through this clavipectoral fascia, because although it's having a very small extent, only this is the extent of clavipectoral fascia. बस यहीं से लेकर यहीं तक ही अटैच हुआ होता है. This deep to the pec major, उसके just clavicular head के deep पड़ा होता है, और just axillary sheath के साथ attach हुआ होता है. बस इतनी सी इसकी attachment होती है. But even in this region it gets pierced, or a few structures pass through it. Now what are those structures? Number one, this is the lateral pectoral nerve, because we know that this nerve innervates the pec minor muscle as well, pec major muscle as well. So lateral pectoral nerve will be passing through, it will be piercing this fascia, the clavipectoral fascia. The second is the cephalic vein, which is a superficial vein of the upper limb. We'll be studying about it later on. Cephalic vein and the thoracoacromial artery, which is a branch of axillary artery. इसको हम बाद में study करेंगे. So and a number of lymphatics जो कि lymph carry करती हैं from the breast and the thoracic region, and they will be carrying them towards the thoracic duct, etc. So cephalic vein, thoracoacromial artery, lateral pectoral nerve, and the lymphatics of the thoracic region are going to be piercing what? The clavipectoral fascia. But we never talked about what structures were piercing the deep pectoral fascia. But yes, we need to know what structures are piercing the clavipectoral fascia. So with this note, we are done with the deep pectoral fascia and the clavipectoral fascia. I hope it was helpful for you. So thank you so much. Allah Hafiz. Take care of yourself.